This plastic surgery video is on a plastic surgery procedure called a closed rhinoplasti. This is a young man who, at the age of 10, was involved in a motor vehicle accident and fractured his nose. He has 2 bumps on the top and sides of his nose, which are disturbing to him. His skin is very thin in that area, and they are very protuberant. I have actually marked them out and put a circle around them. What you see here is the patient is asleep on the operating table, and I am putting a numbing medication into his nose, as well as a medication that causes the blood vessels to constrict down. So this vasoconstrictor will allow me to operate on this man's nose and have as minimal bleeding as possible. And so I will hold pressure on his nose while this medication takes effect. Because I'm going to be doing a surgery from the inside of his nose, there will be incisions made and he will bleed. In an effort to prevent him from having any bleeding drip down his throat, his nose will be packed. This packing will be removed at the end of the surgery. The light that you see is actually a headlight that is on my head, and the light allows me to see within the nose and still allow the visibility for the cameras. After I've packed both sides of the nose, I will proceed with injecting the inside of the nose with more of the same numbing medication and vasoconstrictor medication. And then I will make an incision in the nose that will allow me to gain access to the nasal dorsum, which is the top part of the nose where the bumps are. So after I've made my incision, I will feel through the tissues and get into the correct plane. And you can see how thin his skin is, because you can literally see the ends of the scissors through the skin. So what I will do is I'll go in there and make sure I've undermined enough of the areas that I can get the next instruments I need to perform the closed rhinoplasti. I apologize that it's hard to see, but I have to do the surgery in the safest way for the patient. So you can really see those instruments, those scissors opening and closing once my hand gets out of the way. But again, this is a blind procedure, so I have to feel what I'm doing. And that's why my left hand is obscuring your vision. So because he has a bump on both the right side and the left side, I will have to open up both sides of his nose to gain access to both sides. Often, if there's no side bumps, I can perform the closed rhinoplasti, only make an incision in one nostril. But because he has a bump on both sides, I have to open both sides. What you see here is a nasal dorsum rasp or file, and that's exactly what it is. It basically is what's called a pull rasp, and every time I pull back on it, I'm filing down his nose. And you can kind of see right where that is because the skin is so thin. And so I will file it down a little bit, and then I'll feel it again, and I can actually feel the bump. So I can take down both the bone part of his nose as well as the cartilage part of his nose using this instrument. And I have this instrument with different degrees of coarseness or fineness, depending on how aggressive I want to be. So in essence, I can gently polish the nose or sand it down gently, or I can be very aggressive and take down a lot of the nose quickly. I will use the different instruments based upon the conditions and the requirements for the individual surgery. Now, this is a relatively minor dorsal revision because his nasal lines are really not that bad, and he was very specific in that he really liked his nose. He just was concerned about the nasal bone fractures and the distortion that it looked. Now you're seeing me open and enter the left side, and I'm using that same instrument to take down his left nasal dorsal prominence. on this particular patient, I'm really not filing down the true dorsum of the nose as much as I am taking down the fracture points that were concerning to him. Again, you can see how thin the skin is and how easy it is for me to appreciate where I am. And once I know where I am, I can feel it with my finger. I can then exert more pressure on the rasp and pull and have the rasp do the work. On more aggressive nasal surgeries or closed rhinoplasties, I will actually have an assistant hold the head so that I can be a little bit more vigorous in the sanding down of the nose. But again, this is a relatively mild deformity and will be corrected relatively easily. After I'm satisfied with the feel of the nose and the contour, I'll actually stick another retractor in there and visualize what I have done to make sure I'm not going to leave him with a contour irregularity or deformity that would appear after this surgery was completed. So even though it is closed, I can actually still get a visualization of it. So there was an area that I didn't like, so I've actually passed a pair of scissors in there, and I'm cutting it. So not only did I sand it down, there was another part that I'm actually cutting with the scissors. And I can feel those scissors, and I know right where they are. And I take it down. And again, it's all by feel, and then also direct visualization. So at this point, I'm actually going to close this wound that's in his nose. And this is done with dissolvable sutures. And they will be placed in an individual fashion so that I can see both wound edges and approximate it so that he's left with no deformity or retraction issues in the nostril. These stitches will dissolve, and it takes about 4 or 5 days for them really to dissolve and get out of the way of his normal breathing. The packing will be removed at the end of the procedure. He will actually have a secondary packing placed in his nose to prevent any bleeding that might drip out from the incisions from going down his throat. And that way it will come out the front of his nose, and in essence a runny nose. So he'll wear a piece of gauze on the end of his nose for about 24 hours until that wound stops bleeding, and then he'll remove the drip pad and he will pull out the nasal packing. You can see here that the bumps are gone, and that bruising is characteristic from nasal dorsum surgery, and that takes about 4 or 5 days to go away. But he's had a very nice improvement, and I think he'll be very happy.